Andy, is it Schoonover?
A Schoonover, you got it.
Schoonover. Awesome, awesome. Founder of CrowdHealth. We're going to get into some health insurance stuff, but I wanted to share a little bit in reflection of a recent interview you did with my friends Stu and Bliss over on Birthing Instincts. And I hadn't heard you say this. I listened to a lot of your interviews, but in every major city, when you drive downtown, we got all the skyscrapers. My little girls call them the castles. And the biggest one, the fanciest, nicest one, the one that stands out, tends to be the one that's owned by the market shareholder, the dominant market shareholder insurance company. And I was reflecting on this in Pittsburgh. There used to be a company called US Steel, which was bought by a Japanese company, I believe. And if it wasn't fully transacted, it didn't matter. UPMC, the University of Pittsburgh Medical Center, in their massive HMO, purchased the rights to put UPMC at the top of the largest skyscraper in the Steel City, which I thought was really, really appropriate for the beginning of our conversation. So, is this true in other cities as well? I hadn't actually thought about it.
Yeah, well, at my last company, when I was actually selling the health plans, that's kind of what we joked is when we went into these
Yeah, right, right.
these these little towns, we would look for the nicest building in town. It's usually where the health insurance plan is.
Yeah.
So I remember I think it's Chattanooga is where the Tennessee Blue Cross Blue Shield is. And it's just, sprawling campus. Florida Blue Cross Blue Shield has a sprawling campus. It's got to be, I don't know, dozens and dozens and dozens of acres.
Yeah.
And then Newark, New Jersey, which is where Horizon
Of
Blue
all
Cross Blue
places.
Shield is, of all
Uh-huh.
places. The
Yeah.
big, nice building. At least this is, 10 years ago. I don't know what it looks like now. I try to avoid Newark if at all possible.
I think most people do,
But
unfortunately. Sorry, Newark.
back in the day when I was there, the nicest glass, beautiful building in Newark was Horizon Blue Cross Blue Shield. So I think it's pretty unanimous across the country. You find the
Yeah.
nicest building, you'll find United Healthcare. I've been United Healthcare too. Pretty nice building in Minneapolis. I'm not sure, given all that Minneapolis is going through right now, if it's
Yeah.
still there. But yeah, most of the time that's the case.
Yeah. Yeah. I'm thinking even downtown Pittsburgh, there's the Highmark building. It stands out like a sore
Oh yeah,
thumb.
that's another
It's
one.
quite interesting.
That's
Yeah.
that's Highmark is a Blue Cross Blue Shield plan.
Yeah. Yeah. There it is. Wow. Well, Andy, I'm going to refer to a lot of people to a lot of the interviews you've done, and I want to try to take a slightly different twist on this because I want to be the consumer asking, you know, why is insurance so bad? So just why don't we do a brief introduction as to what crowd health is, and then I've got some poignant questions here, in order for us to elaborate on the problem, and then how is crowd health? Which, by the way, to spoiler, we just joined CrowdHealth in December, and
Welcome.
thank you. And I couldn't be happier with the move because as of the new year, there was a big, ramping up of premiums, and I think everybody's feeling
Yeah,
that. So we'll get
yeah,
into that here. But tell us about you. Tell us about CrowdHealth. You don't have to go through the whole story because I think you probably get tired of that like I do on podcasts. But because I want to get into the meat of this. But what is
yeah,
CrowdHealth? Like what are we talking about here?
yeah. I mean, ultimately, what I found out after getting totally screwed by my health insurance plan is that I could get way better rates if I pay in cash as opposed to paying for health insurance, paying for healthcare services through health insurance. And once I realized this, then I was like, man, I bet you if we could set up a system to enable people to pay their doctors directly, not only can you get better prices, but you can rip out all the middlemen in that, relationship and you can make it back between, doctor and patient.
Right.
And as a result of that, the doctor who there was a study that just came out that was like 2 days a week, doctors are fighting to get paid, through administrative BS. And so if you can get paid at the point of care, you can spend those 2 days instead of fighting your health insurance plan. You can spend those 2 days actually taking care of patients, generating revenue, and therefore it just makes much more sense for doctors to take direct pay as opposed to bill through health insurance. And so once I figured this out, I was like, man, we can build this system. And so I started Crowd Health back in 2021. We've been almost 5 years into it now, and we have 25,000
Wow.
customers, 33,000 bills we've funded to date. And only 29 of them have not gotten funded. So 29 of the 33,000 have not gotten funded. So that's 99.9% that have gotten funded. which is if you look at health insurance plans that deny about one out of every five bills, we're doing a hell of a lot better than they're doing.
Yeah. Yeah.
And it's way less expensive. So I went to the Affordable Care Act just to be like, okay, what would my family pay this year? I think it was like $1,400 or $1,500 a month, and it was $16,000 to $18,000 of a deductible. Well, CrowdHealth, I paid a total of $7,000 last year, and so I'm saving like $15,000 to $20,000 a year just going on CrowdHealth. So by paying in cash is way less expensive,
Absolutely.
and so that's kind of the 30,000 foot view. We're enabling people to pay cash. They're fund each the members are funding each other's healthcare expenses. You get the middlemen out of it. And so I'm happy to go to the mechanics of how it actually
Yeah, we
works, but
will.
that's
We
kind of
will.
the 30,000 foot view of what we're trying to do here.
You know what's unique about talking to you, Andy, is when you join CrowdHealth, you get an app, and there's even a person you could text right there if you have a
Mhm.
question about something. It's so simple that it's almost like, how could it be this easy? And it is that easy. It's actually as simple as like, hey, I need my grass cut, and the neighbor across the street can't afford to cut his grass. So, hey, man, I'm going to pay you to cut my grass, and could you just hit my neighbor up as well? And then when we're out of town, that neighbor might come and grab our packages. It's literally this community feel, and I love that.
Yeah.
It's as simple as you've already made it sound. But we're going to get into the nooks and crannies here. I wanted to share. I looked this up for myself. What would a family of four? I've got my wife and I, both very healthy 40-year-olds, and we've got two little girls, 4 and 5, 5 going on 6. And in my state of Kentucky, it says the average is somewhere around 1,300 or so, dollars for a family of four. So that's per month. I think I'm paying CrowdHealth something like $330 or something like that. And what's kind of interesting is that, and you can correct me if I'm wrong, but it sounds like the premium may change over time, up or down based on the the reimbursements that are being required during whatever it is, quarterly or monthly. And so we're really just bobbing and weaving with one another based on wherever the needs are. And that feels a lot more like a community
Yeah.
than these megalithic, insurance companies that obviously are making a lot of money building these giant skyscrapers or putting their names at the top of U.S. Steel. So my first question for you is when I've looked this up, there was at least 3 million Americans, which doesn't sound like a lot of people, but we're talking about people who have greater than $10,000 in medical debt.
Mhm.
So looking at just that number alone, why are people struggling to get their basic medical expenses paid for?
Well, I mean, I think it's primarily in two places. One is we both mentioned these deductibles, and that's the one thing that people don't really pay a lot of attention to that they
Yep.
need to. Everybody pays attention to, oh, what do I have to pay, out of pocket every month for my premiums, and very few people think about, okay, well, what if something big happens? Like, what happen? What do I have to pay out of my own pocket before the health insurance plan will pay anything? And a lot of times it's 8, 10, 12, $15,000, right?
Yeah.
And so if you
Yeah.
don't have 8, 10, 12, or $15,000 in your bank account, you're in deep trouble if something really bad happens because the hospital will come after you for that money, and oftentimes will put you into bankruptcy or sue you to get that money. And if you don't have it, that's where a lot of these people have significant issues. And in fact, somewhere between 200 and 250,000 families who had health insurance last year went bankrupt due to a medical event.
Yeah.
So you have a medical event and you still go bankrupt, like with health insurance.
With your
And the whole
insurance.
point of health insurance is not to put you in financial distress. And so a lot of people are getting these plans thinking like, oh, I have health insurance, and then something big happens, and they're like, oh crap, now I got to come up with $10,000 to pay because the insurance plan doesn't pay that. And then the second one, this is what I realized after, my fiasco with my health insurance company where they wouldn't pay for something for my daughter that was like, obviously they needed to pay. But, insurance plans deny about one out of every five claims. So I unfortunately was one out of every five, and it cost me $8,000 because they denied a claim for my daughter. And so it's between denied claims and really high deductibles, these people get into a situation in which they just don't have the money to pay these things, and that's why I think you're seeing that number. What did you say it was, like something like 10,000 families that have above $10,000 or
3
something like that?
million
I mean, it's just,
families have at least
oh, 3 million, holy
$10,000
crap.
in medical debt.
And
Yeah.
so
Yeah.
It's crazy town.
Right.
Um,
It's like a credit card you're
so
never going
those
to
are the
pay
two
off.
primary drivers of that.
Yeah. And just to like get a little bit more granular about what you're describing, people they think the cost of that visit or that hospitalization or whatever, hey, it was I don't know, $5,000 and that would have been so much more had I not had insurance. And I'm like, it's an employer sponsored insurance policy. We're not even
Yeah.
talking about the marketplace. The average employer sponsored plans cost you out of your paycheck before you even get that little paycheck in the mail or direct deposited to your account is on average 27,000 annually. So on top of
Yeah.
that, you add the deductible and you add the copays and you add all these other little mysterious fees that come your way. And it's not even a wash. It's like they are just reaping money from you at every turn, and they will look for every reason in the world to deny your claim, as you mentioned. So we have a real sticky problem here. And
Well, I was, people think that your employer is paying for your health insurance. I mean, it's like, no, no,
it's
no.
you.
That's money. That's money you should be getting in salary that
Exactly.
your employer is paying instead for a health insurance plan that's
That's right.
probably not accustomed to you. Like, the employer chooses the health insurance plan that solves the lowest common denominator in their company, right? So they don't piss anybody off. And
Right.
so you're getting a crappy plan, and you're paying a lot for it, and you just don't see it, and so it's masked. And so you don't really get too worried about things that you don't see, but you're getting robbed by these health insurance companies and you're not even seeing it, right? Like
Right.
you're getting robbed blind. Isn't that like a saying? I'm getting, robbed blind,
Right.
blind robbed, whatever it is.
Right.
So yeah, I mean, it's a tragedy.
Yeah, it is. Yeah, people need to really digest that point. This is not money that your employer is generously giving you as a benefit. They're taking it out of your paycheck and then advertising, hey, we're going to give you benefits. And maybe they can negotiate different deals, but it's not a good deal that they've negotiated for you. That's kind of the point here. I even worked for a healthcare system and they're like, here's the plan. And I was like, wait a second, I'm paying that much in premiums and I'm never even using this.
Hmm.
So the next question then, of course, is what is the role of insurance in our life? You know, I don't take my car and then expect my car insurance, at Quickie Lube to change the oil. There's actually a role of being a homeowner or a body owner that I actually do have some maintenance costs here. And fortunately, I have insurance in case my car runs into a pole, because of the ice storms we've had
Right.
or somebody runs into me. So let's unpack like what is the role of insurance? I'm kind of leading you here, but I know that that's also a big part of why I love CrowdHealth.
Yeah. I mean, I think ultimately the role of insurance is regardless of whether it's health insurance or home insurance or, look, I have insurance for my company because I have to have
Yeah,
insurance. Like, cybersecurity insurance and workers' compensation insurance and things like that. And ultimately, it's to take care of the tail risk
right.
of something big happening that's going to put you into financial distress.
That's right.
So then you can decide how much you want to take on your own risk by that how high of a deductible that you have, and then the insurance plan owns the tail risks. And so that's ultimately what insurance is supposed what it's supposed to do, and that works actually pretty well for most types of insurance. The problem with health insurance is that it's so overregulated by the government that all these things that have been set out to protect you, it's like that funny, like I'm the government, I'm here to protect you. Like all these things that are supposed to protect you actually layer on cost and cost and cost and cost, create bureaucracy, and therefore the insurance prices have gone, through the roof. And like you said, I think it has been masked over the last 4 or 5 years, the huge rate increases because of these subsidies. And then the government takes the subsidy away. They're like, wait, hold on. I didn't know health insurance was this expensive. It's the same thing that's happening with your employer. You
Yeah,
don't
yeah,
know it because
exactly.
you don't see it.
Yeah.
Right. And so once you see it, you're like, this is crazy. And you're like,
Mm,
yeah, it's always been that way. You just haven't seen it. So ultimately health insurance is supposed to take care of you in the case of these really big events. And what it has turned into though is a lot more, if your car insurance doesn't pay for your gas, doesn't pay for your oil change, doesn't pay for your tires or rotations. Ultimately what health insurance has become is they're paying for everything. It's not just the big stuff. it's also all the little stuff. And I kind of joke that if car insurance paid for oil changes, my oil change would be 350 or $400.
That's
Instead,
right.
I go to Jiffy Lube and I get it for 49.99, and I get the synthetic, right? Right? Like I can, buy. And so ultimately what's happening with insurance is they are then taking the risk for everything in your healthcare, or almost everything in your healthcare. And therefore the consumer is not acting on in the best interest of the consumer for most of this stuff. And inevitably prices, rise as a result of that. So
Yeah,
anytime you take the consumer out of the equation, then prices will go up, right? Because the
right.
consumer now is using somebody else's money to purchase goods and services. I'm going to the grocery store without somebody else's credit card. Well, guess what? Prices are going to go up. So it's one of those crazy things with healthcare that, and unfortunately, after decades of just overregulation, we got this bulky thing that's going to be very, very I think nearly impossible to reverse.
Yeah,
And that's why
yeah,
we're trying to totally kind of, as we said, burn it down and start all over again.
yeah. Yeah, or at least demonstrate, hey, here's a life raft over here, and everybody over here on this life raft we're pretty set. We feel pretty insured. And that's really for a young, healthy person who, frankly, I don't go to the doctor. I actually don't expect my insurance to pay for most of the things I do to take care of my family because they're not going to pay for, grass-fed beef or,
Yeah.
some cod liver oil or, I don't know, herbal teas, organic or herbal teas from when we get sick, whatever it might be. And that's because that's what we save up for. That's actually how we budget our
Right.
lifestyle so that we don't need to worry about the catastrophe, and yet we still want that tail coverage. So
hmm
tell me about how CrowdHealth is solving the primary issues that people are experiencing within the conventional insurance model.
Well, I think you said it like really well, which is you want to make personal choices for your family that may be different than personal
Right.
choices for other people. And so, in essence, what we should do is we should say, hey, health insurance is covering the absolute minimum, the tail risk, just the tail risk. And as such, we give money back to the consumer so the consumer can make their choices based upon what they want for their family. And if somebody wants to use it for a gym membership, or somebody wants to use it for grass-fed beef or whatever, then it's back into you have now autonomy or sovereignty over your own money, as opposed to the health insurance plans saying, I'm going to tell you what is covered, which means it's covered for everybody,
If it's
which
not in
means
this
that.
rubric, it's not healthcare. Yeah.
Exactly.
Yeah.
Yeah, exactly. And so, if you don't use birth control, too bad. You're going to pay for everybody else's birth control. As
Right.
opposed to being like, hey, let's just not pay for bad birth control. Let's give that money back to the people who want to buy birth control, and you can make your own personal decision
Yeah.
about birth control,
Right.
right? I'm going to pay for, every employer now pays for, these gender reassignment surgeries and things like that. And it's like, look, instead of paying for that, why don't we just give money back to people? So if they want to do that, great. Hey, your
Right.
choice. I'm not gonna, more morality police you, but don't make me pay for it. It's just
Yeah.
like let's do the absolute minimum, and then give money back to the people so they can decide how to spend it on healthcare. And so, for Crowd Health, basically what we're trying to do is like we're trying to offer you the absolute, lowest cost per month so that you can maximize dollars in your pocket. So you can maximize autonomy and sovereignty over your own healthcare using those dollars that you save. Yours is about what do you say, $700 or $800 a month or $1,000 a month or something like that. You can now use that $1,000 a month to do with it what you want, as
Yeah.
opposed to, this kind of fiat system where the insurance company or the government ultimately tells you what you have to pay for. That
Right.
just doesn't seem right to me.
Right. Right.
So that's the way that we've created it, and so you get a lot of more money back in your pocket, so you can decide how you want to use that.
Yeah, from what I understand, I mean, there's a Gordian knot here, a black box, a Pandora's box, actually, if you try to go into the box and understand
hmm
how, especially in my world as an OBGYN, how maternity care is paid for. I mean,
Oh,
there's all of this negotiating behind the scenes. Again, it's just hidden from view where somebody's agreeing that this should be covered by health insurance, and we're going to negotiate this price with the payer, the insurance company, and like the consumer is completely out of this conversation. And so you might go to
totally
one
out of the
hospital versus
conversation.
the other one, and very differing, quality of care, um, very different prices, very different access with regards to waiting. And so you're just kind of caught adrift in this whole process. And one of
Hmm.
the big criticisms I think that groups I don't know, opportunities like CrowdHealth bring up for people is, yeah, but they don't cover that weekly chiropractor visit or this and that. And what you said is really important for people to hear. That's right. If you want to have your chiropractic care covered, you now have a whole bunch of money every month that you can now use. Call it a flexible savings account if you want. Put it into a separate bank
Yeah,
account and use it on whatever you can so that you don't need to lean on that tail risk of you having something terrible happen to you, whether that be cancer, COPD, childbirth, whatever it might be. We'll get to childbirth in a second because that's kind of a special little monster here. But
sure.
um, what are some other facets?
If you make
Yeah,
something available to the entire community,
right,
everybody in the community is going to use it. And then if
right.
everybody uses it because it uses it, your price is going to go up by
Yeah,
the amount people are going to use it. And by the way, the insurance plans are paying way more for it than you can pay for it as a consumer because you bring market forces to,
right,
the market, whereas health insurance doesn't. So the more you ask your insurance plan to pay, the more you're going to pay in premiums and you're going to be paying higher prices for that. One perfect example of this is I keep going back to birth control because I've done a little bit of work on it, but birth control, the price for birth control for the 10 years before Obamacare was going down like this. Obamacare then said, "Oh, health insurance plans, you have to pay for birth control." And guess what happened? Whoop,
Zoop.
it
Yeah,
goes up to the right and gets, I think it's now 3x more expensive than it was right before Obamacare.
right,
Because these health insurance plans, who actually want to see prices for services go up over time, they make more money when prices go up. They're now reimbursing for it, and so you're paying more for it than you would have beforehand. And so you iterate on that like 1,000 times. Obamacare now says you have to pay for all this stuff, and that's why our prices are going up crazy.
right,
So
right, right.
uh, you know give
You're going to
give
pay
money
for it.
back to the people and let them do with it what they want, and that's the key to us and our success, I think.
I think so too. I think so too. I had told you when we first chatted on the phone that I put this little bat signal out on Instagram, and be careful what you ask for on Instagram because I had a lot of people that were like, yeah, I like the health shares and crowd health sounds cool, but you know, they won't cover my birth control or whatever else, whatever the, XYZ might be.
Yeah,
And I think people need to appreciate what you're saying here. Your insurance may cover it, but you are paying for it one way or the other. You're going to pay for it through higher
exactly.
premiums on an annual basis. It's going to keep ratcheting up until you call it inflation, and it is inflation, but it's like a fabricated inflation that's separate from even the global economy. It's a private negotiation that's happening here so that they can still make the skyscrapers, they can still pay their
Right.
CEOs millions of dollars. There are shareholders that have zero interest in what it is that is happening to you and your family. So,
Yeah,
because they aren't paying for it, does not make it bad. Because the savings on the by switching to something like CrowdHealth, you're going to have so much more money now to pay for everything out of pocket. And by the way, when you go to a doctor, which I want you to talk about here within CrowdHealth, if somebody comes to me and they say, "Hey, listen, this lady really needs these labs or whatever. Can you do this for $200?" I might say, "You know what? Yeah, I can do it for $200. The next time she comes back, we'll do it for $150, right? And if she becomes like a part of my thing where we have like now this fluid conversation, you know what? I'll do it for $100.
yeah,
There's that like kind of buy-in, right? So it gives me the ability actually to say, what is my time worth? And you know what? The fact that that lady down the street, whatever doctor, guy or gal, doesn't really matter, is charging 500. I don't think that that's right. I can do this just as well, if not better, and I'm going to be able to charge you 200 and it's no
sure.
skin off my back. So let's talk about the actual negotiation that your company does on behalf of your community members.
Yeah, I mean, I think there's three scenarios in which this is relevant. One is if I go to a doctor like you or my wife does, and says, "Hey, I'm a cash pay patient," then all we do is ask our members just to say, "Hey, I'm cash pay. I want to pay you right now." And
Right.
most of the time, the doctors are like, "Great, like pay me now." Like I don't want to have to go and spend all this money billing health insurance, and so they're typically giving you, what they call a cash pay discount. And it ranges. My wife, just had her gynecology appointment, and she got a 40%, I think, discount by just paying, the credit card right there. And the doctors love it because they're getting paid right away. They don't have to fight with health insurance. So that's one. And we don't do any really negotiations on the small stuff. Let's just say though that you tore your ACL. You're out playing pickleball and you tore your ACL. You're going to go to the ER probably. And the ER is going to try to send you to the orthopedic surgeon in their hospital system, which is going to be really, really expensive. So, we had a woman tear her ACL in Austin, and it was like $24,000 through the orthopedic surgeon in system. She calls us. She's like, "I'm so sorry. I just joined CrowdHealth. I hate this." Well, we had a guy in town who was going to do it for 12,000 if you paid him at the point of
That's
care.
right.
And this is the guy who is doing all the joints or a bunch of the joints for the University of Texas athletics program. So he's good. He's like, what I didn't realize before I got started doing this is like the better doctors are actually typically less expensive because this guy does like, I don't know, like 15 knees a week or something like that. And there's other docs who do like 15 knees a year. And who's better at doing knees? This
This
guy,
guy.
right?
Yeah.
The guy who's doing
A high
15
volume
knees
guy.
a week.
Hmm.
And by the way, when he sees the complication, he knows exactly how to do it because he's seen it 100 times before. And it's just like, like he just rolls right through them and he's really good at it. And so he can do it for a lot less. And so this, she was overjoyed that, he was going to do it for, I don't know, it was 11 or 12 or something like that. So it's like half the price. And so
Yeah.
people don't really realize that because we want to go to the Ritz-Carlton, right, as opposed to the Holiday Inn because the Ritz-Carlton's a hell of a lot nicer. But in healthcare, it's almost a flip. Whereas like the
Right.
really great docs are actually less expensive because they're not typically in hospital systems, because they're so good they can pull in their own business as opposed to relying upon the hospital system sending them business. So they're really good, they're independent, they're fairly priced. And so we try to get our members to these independent docs because they're great, in almost all ways.
Yeah.
That's one of the crazy things about healthcare.
Yeah, totally. I mean, you bring up a really good point. I don't work with insurance companies mostly because it just frustrates the hell out of me. But I have to remind people they're not even going to reimburse me for the hour we spent talking about the traumatic birth that you had, or, me talking to your husband about his fears about having a home birth, whatever the scenario might be. So if I'm
Sure.
going to get paid, I get average probably around $400 to $600 for a consultation. And that might be 90 minutes. It might be 2 hours. It doesn't really matter to me. I get as much time as I want, and I don't have to worry about how am I going to code this and bill
Yeah.
this so that I can get paid for my time. So if you walk in with a billfold of cash and you say, "Listen, I want your help. Can you do this for less than $1,000 from this other functional medicine practitioner or whatever?" I'll say, "Yeah, I'll do it for like 200 bucks. What can you pay?" And if you're
Yeah.
willing, if you're like $200 for you might be a lot more than $1,000 for somebody else, and I'm happy to meet you there in the middle because I have a skill set that you need. And
Yeah.
when we lean on the insurance companies in that whole model, we really kind of take that out as well. This sort of like physician just wanting to do good work. And so I feel like that's a really important point about crowd health is that you're also taking again this bigger view of what does this actually cost. And when we
Yeah.
actually speak to the person with the skills, you find out it's actually far less valuable to them, like from a profit motivation standpoint, and that they have to charge double because there's all these other people who get paid, along the way. So go ahead. I
Yeah.
think you were going to add something to that.
No, I mean, the only thing I'd add is, I think a lot of the healthcare problems we have, in this day and age are health insurance induced.
Right.
They've cut rates so much that I think the average, primary care visit is like 10 minutes now or something like that, which, you can't get into lifestyle, you can't get into sleep and what
Sure.
you eat and what you drink and your exercise and, all these things that are really, really important that are ultimately at the core of what's going on with you. And instead, they have this pharma first type of mentality because they only have time to treat the symptoms. And so you have these people with, these symptoms for, oftentimes decades that turn into chronic conditions and, just destroy their bodies and their, our healthcare system because then
Yeah.
ultimately, Medicare is paying for it. So, I love your model and, we love kind of, functional, non-Western medicine type of docs who are, looking at the whole person as opposed to just, trying to pump people full of medications to make them feel better in the moment.
Yeah. Yeah. Well, if anybody in crowd health ever needs an OB like me, you just text me, okay?
I love
Um,
it.
so we've covered,
Do you do
why
home births? Do you do home births?
I do home births. Yeah. Actually, why don't
Yeah.
we talk about that? So let's talk about
Yeah.
childbirth really quickly. When my wife and I were pregnant, I got fired during COVID for a really silly reason. It was a masking issue, and it wasn't me being defiant. It was me not following a policy, and I don't like policies if it leads to indignified medical care, period.
Mm.
So, anyways, I lost my job and my insurance benefits 6 weeks before we're going to have a baby. And so my wife and I pivoted to home birth. We then ended up submitting the claim for midwifery care, which was I think $5,500 to insurance, and it just so happens that our deductible was exactly 5,500, and so it looked like a wash. We didn't get any of that money back, of course, and we'd already paid for that in our premiums, but we had reached our deductible. I mean, just like
Yeah.
what we were talking about, it was just total baloney. But fortunately, we actually did get it ended up being a wash because we actually didn't necessarily need to invest more in midwifery care because our
Hmm.
insurance at least was willing to play ball with home birth. So, talk to
Hmm.
me about how this model works in an extraordinarily complicated and expensive venue like maternity care. How did you guys
Yeah. I mean,
come to decide how to cover this? I guess is my question.
it's been a little bit of like trial and error to be totally honest with you. We our the average age of the person in the community is 33. And so
Oh, that's
we've got a
interesting.
lot of a
Yeah.
lot of people who are having babies. And we have a lot of people, well, one month or over the summer, I think we had 17 or 18 babies born, and 17, 16 of the 17 or 17 to 18, I can't really remember the number, were born at home. Or sorry, not in the hospital. So they were either like at home or in a birthing center, non-hospital births. So I thought that was pretty interesting. So we have
That is really
a huge
interesting.
community of people who are looking to do this outside of kind of the traditional hospital, environment, which is very, very cool. But ultimately, look, I mean, I think that with births, you also have some complications of that. So, some of our biggest bills have been NICU bills, where the baby's been in the NICU for, months on end, and those can be hundreds of thousands or maybe even millions of dollars. And so, we take a very active approach in negotiating those bills. So, God forbid you go into the NICU, one thing we tell our members is like never pay anything at the hospital. Always tell
Yeah.
them to send you the bills. So they will send you the bills. You upload them to our app. We got people who will negotiate that for you, including an attorney. We get those bills down, substantially, oftentimes 60 or 75%, somewhere in there. And then we'll send that bill to the community to say, hey, you know, Andy or whoever, we don't say your name, but if somebody in Texas had a NICU baby, will you help them? And if you say yes, then money will go directly from your account to the person who needs help's account. And at the end of the day, they'll have enough money in their account to then go and pay for that NICU stay. And so that's how that works. And I've said we've had dozens and dozens of NICU stays, unfortunately, and every one of them has gotten fully funded. So
Yeah.
that's kind of the mechanics of how a NICU stay would work. But for pregnancies generally, you can do it in a birthing center, you can do it at home, you can do it at a hospital. If you're doing it at home, you can have a midwife, you can have a doula, you can get all these supplies. The only thing we ask on pregnancies is, typically with any health event with Crowd Health, you pay the first $500, and then we want you to have a little skin in the game, and then everything above that is eligible for funding. So if you have cancer, God forbid, and it's 2 years long, that whole event is you paid the first $500, and then the rest is eligible for funding because we don't want anybody going bankrupt due to a health
Yeah.
event.
Yeah.
With pregnancies, it's a little higher because it is one of those things you kind of know how pregnancies happen. So you're
Yeah.
making an elective decision here most of the case. So you pay the first 3,000, but that includes prenatal, labor, delivery, and postnatal.
Right.
So it's all one health event because it's when new babies, as right? Like you have a new baby. I felt like I was at the doctors like every other week doing these checkups or whatever, and so it gets really, really expensive. So
Yeah.
we've kind of navigated that over the last few years, knowing that we have a population of people who are going to have a lot of births, and we wanted to make it work for them. And I think we've landed on a really good place.
Yeah, yeah, and you're able to keep those costs down. And I know people are like, but 3,000, that's like a big deductible. But wait a second. Those copays, everything that all those little, if you collect every single receipt from every invoice you paid from the moment you went in with your positive pregnancy test and had the ultrasound and everything, all the way through hospital discharge, you're going to have a lot more money than you realize you actually paid out of pocket. So I also
And
feel
don't
like
forget deductibles,
and the
right?
deductibles. Yeah, of course,
Well,
of
if
course.
you have an $8,000 per person deductible, you're paying $8,000 for your pregnancy,
Right,
and then the baby is born, and now guess what? The baby is now on a deductible. So if stuff is happening to the baby, you got another $8,000 that you're
right.
paying for the baby. And so we just was like, man, let's just make it 3,000. People can plan for it, they can save for it, they can be prepared for it. It's not going to put them into financial hardship, and it's just way easier, I think, in our model to understand how much is this birth gonna cost me.
Yeah,
So
yeah.
and people really appreciate the fact that we don't care where you have your baby. That should be your choice, not some, insurance plan telling you what to do.
Yeah, totally. And I think families are now kind of even crowdfunding within their families whenever a baby is coming. When we call it a baby
Mhm.
registry, this is an opportunity for all of those aunts and uncles and everything to give their $50 because they want you to have something to get started. And that ends up paying for all of the stuff that happens from now until you've got your baby in your arms
Mhm.
comfortably at home. So uh, I think the moral of the story here, Andy, is there is a lot of hidden costs to what people presume is a very, very healthy healthcare industry. And when you start to get those bills, heaven forbid you end up in the ER or in the ICU or whatever, you end up getting those bills and you realize, whoa, I had no idea that all of those premiums I'd been paying for years and years and years, that it wasn't going to be worth more than this, than I got
Yeah.
out of this $100,000 bill or something, which is why so many people struggle with this. It's not a big problem until you have the event. So let me ask you one more thing. You mentioned the $500 sort of ante, to buy into the table.
Mhm.
There's also the Black Swan option,
Yeah.
right? Which is
Yeah.
that's actually what my family did. I'll just let
Yeah.
everybody know that.
Yeah.
Talk to me about the two different levels, just so that people know what we're kind of referencing here.
Sure. Yeah, no, it's a good question. So yeah, so you've got actually two options. One is you can be, out of pocket for the first 500, and that's kind of, we call it our OG product, like our original product.
Yeah,
And then or you have the second option, which is you can be out of the pocket for the first $15,000. And so the big difference there is you're just paying less per month on
right.
the 15,000 side, which means more money in your pocket to do what you want with. And so we just wanted to offer that because we had so many people calling into us and be like, "Can you put together a catastrophic plan?" I originally called it the zombie apocalypse plan, because it's for things that happen, so rare that you only need it, something crazy happens.
Yeah,
Um, I
yeah.
got talked out of that, although I want to go back to it. But
I'm
yeah,
gonna I'm
those are
gonna
the two
put my hat
different.
in the ring there. We should bring that name back.
Go and bring it back.
Yeah,
Those are the two options that you have, and it's just whatever fits your. If you've got $15,000, that if something big happens, you can pay for it. Then go with the Black Swan, the zombie apocalypse. If you don't have $15,000, then I would recommend going with the $500 because everybody can come up with $500.
right, right.
And so that's just kind of the decision you have to make between the two.
Yeah, yeah, yeah. And we'll send people to the website. I do have one more question. I remember one of our community
Sure.
members wanted me to ask this, but I have a code for people. It's Riley, Rley. If you want to go in, I can't remember what that code gets them, but I think it gets them like what is it, 3 months free or something? I can't remember.
Three months for a pretty substantial discount.
Okay,
It's a
gotcha.
30 or 40% discount
Yeah,
for
I
the
want to get
first
as
three
many people
months.
over as possible. Yeah, I think I get some credit too, just for full disclosure. But hey, like if I can get 10 people to join, and that's going to boost up our overall, pot of money that'll
Yeah.
bring our premiums down. It's like a kind of a win-win for everybody. So,
Well, you know what I say is like I would prefer to pay our existing members to go and talk to their people about us than paying the big tech companies, the
yeah,
Googles and the Metas and all these people to
All the
pay and
dorks.
find people, all the
Yeah.
dorks. And by the way, the people that are referred by our existing members are better members of Crowd Health anyway. They're
Yeah.
typically healthy and they know how it works and they don't try to take advantage of the system. So it's like, why would we not pay our existing members to go
Yeah.
find their friends and family? Like I loved when we had a woman last week or last year. I paid them, I think, 12 or $14,000 one month. This woman,
Phew.
because she got so many people to join us. I was like, I love writing that check. That's
Yeah.
amazing.
Yeah. Yeah. Right. 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 By the way, Highmark Blue Cross Blue Shield is not offering that. That is not on the table as of right now. So maybe
No,
we'll
I
get
don't
enough
think
market
that.
pressure to get them behind that too. One final question, Andy. Somebody from my Born Free Method community who they're pregnant, they're preparing for their pregnancy. She happened to be a healthcare economics student in her master's program, and she had let me know that there was a recent change with the Big Beautiful Bill or whatever it was called recently, where HSAs could now be funded by even those consumers who had um, these like very catastrophic these very fine end of the tail on the risk end, as opposed to just a low deductible, what was it, a high premium, or low deductible, high premium plan. No, low premium, high
High
deductible plan.
deductible HDHP is a high
Yeah,
deductible health
yeah.
plan. So
Does
typically,
CrowdHealth qualify for that? Sorry, go ahead.
yeah, no, typically you had to have a high deductible health plan to be a part of this. They did open up what a high deductible health plan meant. It still didn't, go into to us, and so this is all post-tax stuff. So we don't have access to HSAs yet, but we're working on it. There's a couple, people on both sides of the legislature that are really interested in opening up. I don't know why you can't get an HSA regardless of your insurance status. Like, why do you have to have a high
Mhm.
deductible health plan? And I think a
Right.
lot of people, agree with that. So we're working on that. So hopefully an HSA would be, eligible here sometime shortly.
Great. And anything else coming up in the future for CrowdHealth? Like, how would you like to see this scale, if at all? I'm curious.
Yeah, I mean, we're at 25,000. I just, funny enough, had a meeting with a couple of my investors yesterday, and we're going to be probably around 50,000 by the end of this year. So we're going to be scaling pretty quick, and our goal is 100,000 the following year. So we're going to probably double, every year for the next few years, and I think that's going to, hopefully, create some scale here where we really can prove that paying your doctor directly as opposed to health insurance is a viable way of doing things.
Yeah.
And so that's the ultimate goal. Pay is the way. But so we're excited to kind of spread that message. Exit the system and pay in cash. That's ultimately what we're trying to get people to do.
For real. And over time, that will save you so much money. We have a hard time
So
with
much
this.
money.
We have a really hard time as individuals with this. If you pay now, you can save later. This is actually how the super wealthy have become so wealthy. They make big investments now in order to save themselves later. That is the same as giving yourself a raise. And so we need to start thinking about healthcare in that way too, which also starts with getting outside, eating good food, going to the gym, getting to sleep, having good relationships, managing your stress, and all of the money you save can be invested into those lifestyle, I'm using air quotes on my end, and environmental factors that actually make us sick to begin with. So,
Yeah.
um,
Yeah. Amen.
Andy,
Amen.
it's joincrowdhealth.com, right?
You got it.
All right.
joincrowdhealth.com. And it takes like 5 to 7 minutes to sign up, maybe 10.
That sounds so stupid
You
easy.
can
Yeah.
you can start whenever you want. You can end whenever you want. So we don't have these open enrollment periods or anything like that. And use the code Riley for, first 3 months. It's, somewhere between 85 and $90, per month for the first 3 months. And it's like, look, try it out. If you like it, stick with us. If you don't, you can cancel anytime. So, it's worth the money to try us out and see if you like it. I can tell you that, the only people that like us, more than our doctors are our members. Like the doctors love us, the members love us, and because it's just such an easy system.
It's
It's
so
a
easy.
hell of a lot easier
Yeah.
than navigating through this complex health insurance, led system that we currently have. So we'd
Yeah.
love for people to come and join us.
Awesome. Andy, thanks for your time today. Appreciate you.
Thanks for
And
having me.
yeah, and I'm sure we'll be in touch.
Good stuff.